It's Positively Muskegon, Andy O'Reilly here today, and I have got great guests. Dr. Samir Hamati is here, and you're going to have to help me with this last name because I've been talking to Sarahjean here for quite some time. Is it Ciezak?
Ciezak.
I got it. Speak right up, Sarah. You got to get good and loud.
Got it.
It's one of the more uncomfortable topics that we've discussed so far here, but health is important, and we have to talk about endometriosis, which the first thing I found out through Sarah here was it's remarkably hard to spell. It's a big word.
It's a big word, but most patients, unfortunately, most patients are aware of endometriosis.
Are aware of it.
Yeah.
Dr. Hamati, talk a little bit about endometriosis and what is it?
Endometriosis, so far, unfortunately, we really don't know exactly what the cause of it. We have several theories on endometriosis. We think the lining, instead of shedding out vaginal, can backflow through the tubes.
Okay.
So you have cells, now they are on the outside. They are uterine cells, but they're outside.
Okay.
And those cells are fed by estrogen, and then they behave and then start causing pain and adhesions, etc. But this is really not the only theory. We think also it could be spread through the blood, hematogenous, or it could be spread through the lymphatic system. But the majority of the time, we think that there's really a immunological reason. So once you have the disease, because a lot of patients can have the retrograde and they don't have endometriosis, so that means I think there's some immunological reason why some people has it.
When would a woman start to know that there's some kind of problem?
The majority of the time, average age we talk about is like really about 28.
Okay.
So that's the average age, and then the symptoms are related to the pain, and the major ones is going to be, is the patient is infertility is the problem, which could be about 38%, or is it pelvic pain? And if it is pelvic pain, it could really go up to almost 80%. And obviously pain is going to be quality of life.
Yeah.
And and I think the most important too is looking at what the patient desires. Is she looking for future fertility? Or right now she's not, but she's going to consider it in the future? Or a patient who's really having history of endometriosis for some time, had her babies, and tried everything, and what to do.
Right. So there's plenty of options, and it's not necessarily the best choice to go in and do a hysterectomy and all that.
Correct.
So you guys are trying to get a little further away from that.
Definitely. I think you can have a 18 years old, unfortunately, with a lot of endometriosis, and she's going to be looking for the future to have fertility or to have children. So you're really trying to make her quality of life between age 18 till whenever she decides to have future children.
Perfect.
So that's where that's where the emphasis of the treatment is going to be.
Sarah got a hold of me because of this movie that's coming to Cinema Carousel.
Yes.
Which was you got to talk right up, good and loud.
Sorry.
That's okay.
I'm usually loud.
I know. That's okay, but this movie is a big deal. It's called Endo What?
Yes.
And I want to talk about your experience with endometriosis. And this could get uncomfortable. It's not easy for
Yes.
people to talk about their medical
No,
things, but
it's not.
you're at the front line here.
Yep.
Talk about your experience with endometriosis.
I was a lot younger than 28, and I started having horrible pain. And my mom took me to the doctor, and I just remember it took a long time for them to diagnose it. I went to many doctors, and I don't remember exactly how old I was when I had my first surgery. I think I was about 17, and I've had probably 6 or 7 laparoscopies, and none of them have worked. And I found Dr. Hamati, thank God. He is going to do my surgery, another surgery, June 24th, and I really hope that this one works.
He's got quite a name around town. That name Hamati, boy, that pops up. Everybody goes, hey, quality.
I pray this one works because I am in horrible pain all of the time.
It's constant pain.
It's horrible.
All the time. What would you equate it to? Would you equate it to like a cramp? Would you equate it
It's
to
like someone is taking barbed wire and wrapping it around my
barbed
insides
wire
and squeezing it.
that
Yes.
bad?
It's
And it's
horrible.
constant.
Yes.
Never ends.
No.
Not depending on the time of the month or
No.
Really?
All the time.
I don't know a lot about women's health. I guess and I'm not laughing. But yeah, I know I'm lucky, right?
Yes.
How many, do you talk about this with your girlfriends?
I do.
Yeah?
And I think a lot of girls probably get sick of hearing about it
Yeah.
because you look like you feel fine on the outside. And they think that you complain all the time and that you want them to feel sorry for you, and that's not the case. I don't
Right.
want people to feel sorry for me. I just want to feel better.
Right. Do you find this with your patients? Do
Definitely.
you find
I
that
mean,
it's a hidden?
It's a big problem because it's a quality of life, and the question becomes, so we have really, the treatment has to be offered of what the patient goals, or almost we call it individualized treatment. So if I have a patient, she is 18 years old and she's having a lot of pain, and we tried what we call some conservative management first, starting on birth control pills, and if birth control pills are not working, sometimes it'll be nice to try continuous use of oral contraception, and if that doesn't work, then surgery, what we call laparoscopic surgery, which we look inside and to confirm the diagnosis and evaluate how extensive the endometriosis is. We divide or classify endometriosis as minimal, mild, moderate, severe, but really this does not correspond to pain, because you can have a patient who has early or minimal endometriosis and she just have a lot of pain, and somebody can have stage 4 endometriosis or extensive and she never knew that she has endometriosis. So the question is, so to have 7 laparoscopies, there's something is not right.
Yeah.
Or even 5 laparoscopies, or even 4. The question is going to be, if I have a patient who's having endometriosis and I diagnose the endometriosis, and by laparoscopy that we look inside and we look for some, we call it dark implants, and now we have newer classification, red or white, or sometimes there are scarring from the endometriosis. So the best thing to do, and now we're really enabled to do it robotically, because you can definitely excise the disease or excise those implants, and if somebody has a lot of scarring, you definitely have a much better way of releasing the scarring. And and if somebody you did what we call the surgical treatment alone is not going to be enough.
Okay.
So you really have to follow for that patient who, let's say she's not planning for pregnancy, you really have to follow her with medical treatment.
Sure.
Medical treatment meaning, does she want to be on birth control pills continuous, or we have IUD progesterone type, or we have medication, we call it Lupron. What it does is just put the patient in menopause. The problem with this medication has its side effects of causing problem with the bones, and so if we would rather use something different. And so let's say that patient, we excise the implants and release the scarring, and she does not want to get pregnant. I think that patient will be definitely much better to be in a continuous use of birth control pills, or if that doesn't work, then to add some other medical treatments that we use.
This is all put together in a movie, a documentary called Endo what?
Yes.
Tell me about your first exposure to this film.
I actually found it online.
Okay.
I watched it and I cried.
Well, I mean, it's
there was
understandable.
Yeah, tons of girls on there that went through the same thing. Saw tons of doctors. It was really interesting to watch, and I really want other people to watch it.
It's a big deal.
Yeah.
Yeah.
And a lot of girls are like, oh, I don't need to watch it. I know about it. But, you might have a child someday that has it.
Mhm.
So I just think it's good for people to watch it. I think that a lot of people out there don't understand the disease. So I'd love to spread awareness, and I think that people should come see it. I think it's a good thing.
And that's important point that you said, because it's really genetics. So if mom has it, or if we call it the first relatives, it's higher chances for endometriosis.
Really?
So it's definitely important to.
I remember when I got pregnant, I prayed that I was going to have a boy because I didn't want my daughter to have it, and I had a girl, and I just hope to God that she doesn't end up end up with it.
Well, I mean, but you'll be
Yeah.
you'll have the knowledge ahead of time
Right.
to help her deal with it if
Right.
she does. When is this showing at Cinema Carousel?
Thursday, June 16th
June 16th,
at 6:30.
6:30. Is there going to be a talk or any other information there during the showing, or
I'm going to speak before the showing.
you are? Okay.
Yes.
Is it tough?
Yes.
Is it?
I did go speak at Ross Medical School about a month ago.
Yeah.
And I started crying, and I was very embarrassed that I started crying, but when I started crying, a couple girls in the class started crying too, because they came out and told me that they also had it. So I felt good afterwards, like, I helped other people, so.
It's an empowering thing.
Mhm.
I've been known to go tell my story of sobriety places.
Yeah.
And you never know who you're going to connect with, and I can see it in your eyes right now. It's a
I'm trying
difficult
not
thing,
to.
but you know what? This is the first step of awareness, and you, in my mind, are a pioneer in this, especially in this area, because it's one of those things that nobody really wants to talk about.
Right.
It's hard to talk about reproductive health.
Yes.
It's there's an element of people out there that are it's reproductive parts,
Yeah.
and there's an element out there that are just scared
Yep.
of it, and to know that you're willing to step up and share this message, I think that makes you kind of a hero.
Thank you.
And I think it's important, because really the treatments varies. Sorry, I don't have Kleenex here.
Good.
The treatment varies. For example, if we look at endometriosis can present itself with implants on the peritoneum, or the ovary itself is diseased, where the ovary is enlarged, depending on the size, obviously.
Yeah.
So the big problem is, or unfortunately some physicians, they have we call it the chocolate cyst. They just drain it, and draining it is not going to be a cure for it.
Right.
So really the best way, and that's what I think can exciting about robotics, that you can remove that chocolate cyst of the ovary. At least the patient have a better chance for control of the
Yeah.
pain.
Good.
The only thing too, everyone has this problem. So if you take too much, sometimes the patient can lose some of the reserve of the ovarian function.
Sure.
But and that's where I think it's so important to look at when you plan your treatment for the patient.
Sure.
The other thing to, if a patient, for example, done having children and the pain is severe, affecting her life, there's really nothing wrong to do a hysterectomy.
Okay.
My emphasis here will be, years ago we used to recommend to remove the ovaries. I think right now conserving the ovaries is very important. Why? Because the benefits, and actually taking the ovaries at a younger age, the risk of heart disease is higher. So definitely that's something that patient has to discuss with her physician. If it was myself, I would definitely recommend to keep the ovaries,
Okay.
unless the patient has a history of ovarian cancer in the family, that there is really more need to remove the ovaries. Yes.
Get rid of them.
Yeah.
I think you're a rock star.
Thank you.
I think you're awesome, and to think that you can talk about something so personal and so painful and so hidden to so many people is speaks volumes of your character. You should be very proud of what you're doing and how you're helping other women that you'll probably never even meet just
Right.
by them watching this today and being a part. We'll put all the links to the tickets, to the showtime, to everything else. Do we need to put a link to you too, Dr. Hamati?
No problems, yeah.
Dr. Samir Hamati and Sarajean Ceizak. The film's coming up at Cinema Carousel. Make sure you get your tickets in advance. That's a big deal. We got to get this thing. Well, how many you got to sell?
67.
67 tickets is what they got to sell. It's informational. It's stuff you're not going to get to see anywhere else, and it's really important for women's health. Doctor, Sarah, thank you for
Thank
coming on
you.
today.
Thank you, Andy.
Positivity
Thank
is
you.
Geek, and get those tickets.
All right.